Hi everyone. Today we're going to talk about measuring an infant. So we're going to do the head circumference, the chest circumference. We're going to do a baby's length, not the height. They're lying down, so it's their length. And we're also going to do their weight on the baby scale. So first, when you call the patient back and their caregiver, you're going to have the caregiver remove any of the extra blankets, clothing, have the baby down to their diaper. You will take the baby and move them onto, it would probably be an exam table. Right now we're just going to use this table because it's just easier. To get the baby's length, we'll start with that. You're going to take a pen, you hold onto your baby and make sure that you have control of the child. When you are responsible for this child, you never turn your back on the baby. They're always in front of you and you have a hand on them, making sure newborn isn't going to move too much, but as they get older, they're going to try to roll over, they're maybe going to sit up, whatever, and you need to make sure that that child is safe. So you put your hands on the child to make sure that they're going to be staying there. You take your pen. Now I would need it completely vertical, straight up and down, otherwise you're going to get inaccurate results. So you're going to go straight up and down. You're going to make a mark on the paper. And now, oftentimes what a baby's going to try to do is pull their legs up. And so it might be a little difficult. You're not going to apply a lot of pressure, but gently you're going to put your hand on the baby's knee and try to straighten their leg out. Sometimes it takes a couple moments, but you will eventually get it. Now, on the other end here, you're going to make a mark. This mannequin's a little different, but you have their foot up. You're going to make a mark where their heel is on the paper. After you do that, you need to go back to their head and make sure that when you were measuring the baby by the foot, you didn't pull that baby down. And so make sure that that head is measuring at the same spot. At this point, you can take the tape measure. We're going to measure the head circumference. You go all the way around. We need the 0 to be right at the top of the baby. You're going to be measuring right above their eyebrows and in centimeters. We're going to do all of our measurements in centimeters. So for this baby, I get 38 centimeters. Now, because my memory doesn't keep a whole bunch of numbers in there, I like to make sure that I write it on my paper. I get 38 centimeters head HC, head circumference. When you're measuring, you also want to make sure you do not have the baby's ear tucked underneath the tape measure, that the tape measure is flat on the baby. And just go all the way around. And please note where the measuring tape starts. Some are a little different than others, and so make sure you know where that 0 is. And make sure you're on centimeters, not inches. Next, we'll go down to the chest circumference. This isn't something you're going to be doing very often. Head circumference, a little more often. Chest circumference, oftentimes they do after a baby's born, or maybe if there's some kind of health issue that the child has, you might do that a little more often. You're going to do the chest circumference right at the nipple line. Once again, go straight across. Make sure your tape is lying nice and flat. You're going to do the centimeters again. So I have 32.5. I'm going to write that down on my paper. 32.5 centimeters for chest circumference. Okay. And now we're going to move over to the scale. I will be putting my gloves on at this point. If there wasn't a need to do so earlier, I'm going to wash my hands again. I did so earlier, but I'm going to wash them again. I'm going to put the gloves on because we're going to be removing the baby's diaper. And we never know what surprises babies are going to give us. So we're going to loosen the diaper on the sides, underneath here. And now we're going to bring the baby over to the scale. I'll show you on here. On this scale, you need to turn it on. And then there's a button that says tare. You're going to use that one to make sure the scale is zeroed out before you put the baby on. Lie the baby on the scale very carefully. You're going to be watching close by. Remove the diaper. Now notice I have kind of the diaper over to shield just in case. And it comes out that this baby is 2.70, and this is pounds, believe it or not. This would be a very malnourished child, but obviously this is not accurate as far as a real baby. But what you do is you can hit the pounds and kilograms, and now we have 1.23 kilograms. You hit the button again, and it's 2 pounds, 11.5 ounces. So you can change that with this button here between pounds and kilograms and pounds and ounces. So as soon as you get whichever one you want, if you want to record pounds and ounces, that's fine. You can write that down here, 2 pounds, 11.5 ounces. And then we put the diaper back on the baby. Once again, I make sure that the child is safe on the scale here. We do not ever want to turn our back when the baby's on the scale. We do not ever want to let this baby fall or any harm come to it, because right now they're in my care. So at this point, I would take baby and I would hand it off to the caregiver, and then they can get the baby dressed again. And then with this information that I've written down, and now I have to go back because I've forgotten one very important thing. When we come back over here, we're going to get the baby's length. Remember, we measured the head and we measured where the foot was. We're going to measure between those two lines, and I get 50.5 centimeters. But because you have your lines, you can really do that anytime. Okay, I write that on my paper, and then I take this information and I put it in the baby's chart. And you know what, I could actually show you today also. Here's a growth chart. This one is specifically for boys. There's another one for girls. On this chart, it has the length, and it's in centimeters or it's in inches. And it's also the baby's age. So if this is a newborn, age is across here, length is here. So if we have 50.5 centimeters and it's a newborn, it's going to be right down here by the 50. And we also have the baby's weight and the baby's age. So we have the baby's weight, well, this one is very malnourished, but anyways, a little over 2 pounds, and the birth weight, we just plot it on there. And each time the child comes in, you can plot where that child is at each of their well child visits or any other visits to the pediatrician. But just for you to see that this is the graph you may be using, or otherwise, a lot of times they'll just be online in the EMR. You can just record the length and weight, and sometimes it automatically populates it for you. But at least you have eyes on this. So, and that's it.